Welcome to the Pharmacy Frontiers podcast, a podcast dedicated to the profession of pharmacy. Today, we're excited to turn over the podcast to the students from the St. Louis College of Pharmacy at the University of Health Sciences and Pharmacy in St. Louis. We give credit to Professors Stephanie Lucas and Terry Wahulik for mentoring these students for these leadership podcasts. Let me remind everyone that the Pharmacy Frontiers podcast is available for streaming on your favorite podcast streaming app, whether it be Apple, Podbean, Spotify, or YouTube. The comments and opinions shared today are those of the hosts and our guests and are not official statements of the Missouri Pharmacy Association, Mitchell Pharmacy, Mercy, or the University of Health Sciences and Pharmacy in St. Louis. Today, we welcome 4 students from the pharmacy school with a podcast entitled Dose of Knowledge, A Day in the Life of a Pediatric Pharmacist.
Hello, everyone, and welcome to our episode, A Day in the Life of a Pediatric Pharmacist. We hope you are exploring all things of the pharmacy world. My name is Morgan Pavizza. I'm Japanese Sounds. I'm Hannah Bergson. And I'm Elizabeth Santiago. And we're all second-year pharmacy students at the St. Louis College of Pharmacy at the University of Health Sciences and Pharmacy in St. Louis, Missouri. Today, we'll be talking about, you guessed it, pediatric pharmacy. We'll go over some basic facts about what a pediatric pharmacist exactly is, what they do, and we'll even get to hear from an actual practicing pediatric pharmacist later on in the show about what she does every day at work. We are so excited you decided to listen to us, so sit back, relax, and let's learn about the world of pediatric pharmacy. All right, so now before we go ahead and actually technically define what a pediatric pharmacist is, we wanted to kick off the podcast in a little bit of a fun way. So we decided to ask first-year college students who have freshly graduated from high school what they believed a pediatric pharmacist is or what they do. So now it's time to roll the clips. So here is the first one. They definitely make drugs for kids, I think, but is that all they do? I think they probably do a little bit more. Let's hear from another one. Okay, for sure. Okay, what do you think about this one, guys?
More close. He's closer to the real definition. I like that. I'm right track.
But they're forgetting that, pharmacists are medication experts. So let's hear this next one.
Pharmacist is someone who helps.
I definitely think it's getting closer. We're getting farther, but they do a lot more than just that. Exactly. So now let's get the actual definition from, which is a larger national organization that oversees all things pediatric pharmacy.
So let's start by defining what a pediatric pharmacist is. So they are licensed professionals with at least 5 years of highly specialized pharmacy education. They often have completed doctoral degrees in pharmacy or PharmD and postgraduate residency programs that make them the nation's medication use experts.
And I know a lot of people think, and according to a Pharmacy Times article, one big misconception a lot of people have is that kids are just little adults, which is not true. Kids our guest speaker later, Amber, is going to have great insight on that, and she'll go a little more into what exactly needs to happen for dosing for kiddos and all the fun stuff. All right, so now we're at the part of our podcast where we get to bring in a very special guest. Everyone listening, you're in for an extra special treat. We're talking with one of my favorite pharmacists I work with on a weekly basis. This person's just absolutely amazing, and I'm so excited that she's here to talk with us. But without further ado, we are going to welcome Dr. Amber Laurent. She's a residency-trained, board-certified clinical pediatric pharmacist. She's a St. Louis College of Pharmacy alum. She graduated in the class of 2019. And she's worked all over the place throughout the Midwest and has even gone east to New York. Experience. So everyone welcome Amber. Hi.
Thank you so much for being here with us today, Amber. We are super excited to talk to you. Just to get right in it, we want to start off by just asking what attracted you initially to pharmacy.
Yeah, so I've always wanted to do something in the math science field, and I was really drawn to chemistry in high school. But I didn't really want to do something that was going to be more of like hands-on, like a nursing job or being a doctor. I talked to a family friend who is a pharmacist, and she really said that she liked that she got to do the math and science while also helping people, which really sounded great to me. And so after talking to her, it really drew me into the pharmacy career.
Absolutely. And I know that a lot of high school students, at least I felt like that way too in high school, where you know the things you like to do, but you're only really exposed to medicine or nursing. So it's hard to look at other fields and see what other options you have. So what was a little bit like your path towards pharmacy like and the jobs that you currently have?
Yeah, that's a great question, and something that I was definitely stuck thinking about whenever I was in high school. It was towards the end of my high school career. There was a recruiter that came from St. Louis College of Pharmacy and talked at my high school. And they really explained what a pharmacist was and what they did and how you really got to help patients out and how it was different than doing medicine like a doctor, and it was different than nursing, but you still get that patient interaction. And so after hearing from that recruiter, and then also after talking to my family friend who was a pharmacist, I really started to like that idea of that career more and more. So as I was graduating high school, I applied and got into Stillcop. And even though I didn't know what I wanted to do in pharmacy, I learned so much more about what actually it means to be a pharmacist and how many different options that there were in the field of pharmacy. As I continued through my schooling and learned more about the field through various jobs as a pharmacy intern and volunteering, I found that I would be best suited for hospital pharmacy. When I started looking at hospital pharmacy and what this actually meant, I learned that I would probably have to do residency in order to achieve this goal. So during my last few years of Stillcop, I started planning out what I wanted to do for my advanced pharmacy practice experiences, or APPEs, and what rotations would best set me up for hospital pharmacy and getting a good variety of experiences and things that I was interested in. And so I knew that I was interested in a few different things, such as pediatrics and oncology. So I made sure that I set up some rotations in each of those. I found out that my rotations in pediatrics really just secured that for me, that I was meant to be a pediatric pharmacist. And basically the entire environment of pediatric pharmacy is just so different and definitely fit my personality better than any adult pharmacy I'd ever been in. As I was rounding with my preceptors, I learned how much providers really rely on pediatric pharmacists because everything is weight-based and it adds an extra layer of difficulty to the ordering of medications. There's also so much different about pediatrics in the way of pharmacokinetics and pharmacodynamics, all the way from a neonate to an infant to a child and then even to an adult. It opened my eyes to a whole new world of pharmacy, and I just absolutely fell in love with it. After my APPEs, I applied for residency at SSM Health Cardinal Glennon Children's Hospital, which was one of the APPE rotations that I had. And I fortunately had the opportunity to complete my first year of residency there. My first year of residency was definitely challenging, which if you hear from other pharmacists is probably the same story, but I would absolutely do it again as I learned so much, not only about the field of pharmacy, but I also grew as an individual and learned to have confidence in myself in all aspects of my career. This involved pediatric knowledge, public speaking, providing recommendations on rounds and how to go about that in the best way, and even how to love my job in the midst of a lot of stress. I was able to do a second year of pediatric residency in New York at NYU Lingo and Health, Long Island, in which I was able to see pharmacy in a whole new light from the Midwest. I also saw just a whole bunch of new ways to do medicine. It's crazy how once you get out of a certain region of the US and move to another, everything is basically different. I chose to go to New York because I was born and raised in the Midwest and knew that I needed to put myself out of my comfort zone in order to get the most out of my PGY2 or postgraduate year 2 experience that I could. I was in New York during the height of COVID, 2020 and 2021, and was amidst all that chaos, but still learned and gained a whole bunch of experience while I was there. After completing my PGY2, I came back to St. Louis and worked part-time at St. Louis Children's Hospital. There, I rotated through a bunch of different jobs, floating to basically things like medication reconciliation. I did some pediatric psychology. And then soon after that, a pediatric ICU clinical specialist position opened up at Mizzou. So once that opened up, I went to Mizzou and was the pediatric ICU pharmacist there. Then after about a year or so there, a full-time job opened back up at Cardinal Glennon where I did my PGY1, and I made my way back to St. Louis to be closer to family and friends.
Okay, great. And what do you do on a daily basis at work?
Yeah, so there's 3 main jobs that I really rotate through in my day-to-day. The first one is working in the central or main pharmacy. This is where I will sit in basically a group of pharmacists and we'll be at computers and we verify orders. In pediatrics, this is more than just double checking to make sure that they order the right dose. There's a lot behind the screen, I guess. In pediatrics, everything is weight-based, and then you have to make sure that once they get to a certain weight, then you're doing a flat-based dosing that you would more see in an adult situation. It gets a little bit more convoluted with neonates because you have gestational age and postmenstrual age dosing. Other things that I look at are making sure that we order the correct formulation for a patient. So things that you don't really think about is if someone ordered a Tylenol tablet, you have to think about, can this patient even swallow a tablet? Or did they order something that can even be utilized by a patient, such as like an inhaler? So that's mostly what I do whenever I'm sitting at my computer. We also do customized TPNs or total parenteral nutrition for most of our pediatric patients. In adults, generally, you just order a TPN and it's something you grab off the shelf, you pop the bag, and then you throw a label on it. In pediatrics, we check labs at least twice a week and make sure that we order things based on their labs. And so this will be based on how much glucose the patient needs, how many lipids for calories, how many amino acids for protein to make sure that they're getting enough to grow. And then also looking at things such as micronutrients and all of their electrolytes. And so this is a very in-depth process, and second pharmacist always has to double check our work after we enter these TPNs. Other things that we do, I answer phone calls. This could be anything from compatibility questions such as, can I run this IV Tylenol with my TPN, or can I run vancomycin with another antibiotic such as cefepime? So we look those up, usually using Tristel's database. Also, we answer phone calls like, where's my medication? And so we have to be sure that we know if it's stored in if the medication is stored in the refrigerator or if it would just be fine at room temperature. I also attend codes and traumas. Generally, in this setting, I draw up weight-based doses for patients. This includes things like epinephrine and sodium bicarb. And with adults, you can just hand off the whole syringe of the epinephrine, but for pediatric patients, we have to show up to the code, ask what weight we're using, and then draw up a small dose from that big epi code dose box that most people are used to in the adult world. We also do non-sterile compounding, pre-packing medications, and then another big part of our job is vaccines, because most of the vaccines that people get throughout their life are whenever they're younger. And so looking at the CDC vaccine schedule, or the Center for Disease Control and Prevention, their vaccine schedule is something that I always have pulled up, just because that is not something that I am able to memorize. But that's generally what I do when I'm in the main pharmacy. One of the other main jobs that I rotate through is the IV room. Whenever I'm in there, I make sure that things are diluted to the correct strength, making sure that if with our little patients that all of the doses are actually measurable. We also have to do cleaning and other dilutions in the IV room, leave batch products, because a lot of adult formulations, such as antibiotics, are not really made in the correct dilution for a pediatric patient. And so a lot of times we have to reconstitute a vial of vancomycin and then further dilute it so that we can run that in a pediatric patient. We physically check the TPNs to make sure that they don't precipitate. We have to understand stability versus sterility with IVs, and if medications need to be refrigerated or not. And lastly, my third role is to be a clinical pharmacist float. And so whenever I'm on this role, I'm rounding with the team, and generally we do bedside rounds and go room to room, round with the family, talk about what's going on with the patient, and come up with a plan for the day. When I'm doing this, mostly I'll be doing all the dosing and frequency of the medications. I do a lot of antimicrobial stewardship on rounds and make sure that we order the right antibiotic for the right disease state or the right infection that we're trying to treat. I recommend vaccines based on the patient's history of immunizations and how old they are. I do medication reconciliation just to make sure that what the patient takes at home, we have ordered appropriately in hospital. I also do discharge counseling on all new medications, and this may be with the patient or with the parent based on the age and comprehension level of the patient. And the other thing, since I work at a teaching hospital, I also will teach medical residents and students while we're rounding.
Well, that was so much that you do. And I really want to just kind of like add it in, because I know earlier in the podcast, we talked about like how kids are just not like little adults, and that's specific. So I really like how, like, what you do every day. Pediatrics and like dealing with kids is a lot different than dealing with adults. So thank you for telling us about your day. What advice would you give to anyone wanting to pursue a career in pediatric pharmacy or just pharmacy in general?
That's a great question. I would recommend that you get out there and shadow anyone who you think has a really cool job. Most places will allow you to shadow and see what their job really is, because it's not usually what is said on paper. Also, I would recommend trying to get work experience during school. That actually helped me study and take tests better. I would say getting involved, especially in research, is really helpful, especially if you are considering doing a residency. And just try things out until you find something that you absolutely love. Because if you're trying to find something that you're going to do for the rest of your life, you want to make sure that it's something that you're passionate about and that you really love, and that you'll get things out of in life. Also, on top of the fact that you're giving back to the community and doing great things for others.
Thank you so much for sharing that with us, Amber. What would you say is the most challenging part of your job?
I would say probably prioritizing tasks is a difficult part of any pharmacist job. So right now there is a technician shortage in a lot of pharmacy. And so knowing when to help out the technicians and when to delegate things to other people whenever you've got 3 phone calls on the line and doses that need to be checked, a trauma call in the ED, just being able to prioritize what to do next. As you heard me say earlier, there's a lot of things going on in the pharmacy all at once. And so it's helpful to be able to prioritize. The other challenging part, specifically for me, I find work-life balance to be a little bit difficult coming from residency where you do a whole bunch of things in a short amount of time, and spending a lot more time at the pharmacy than a lot of my coworkers. Learning how to step back and enjoy my hobbies again outside of just residency and work all the time. And so that's something that you really have to like take a step back and take care of yourself also.
No, 100%. And it's very important. And I know they stress that to us while we're at school. So for everyone listening, even when you're in high school or if you're in undergraduate school and all of that, take time for yourself. It's important. Amber said so. All right. So, okay. So the most challenging part of your job came up. So now I guess we need to go back and circle back. So I know you said like earlier, you have the opportunity to counsel patients on new medication, on all like new medications heading out of the hospital. So what is the main difference when you talk to patients versus their parents? Like, is there much of a difference, if any?
Yeah, that's a great question. So knowing when to talk to the patient versus the parents can be a little bit difficult. And whenever you're going in to counsel someone, you don't always know the patient beforehand. So you kind of walk in and judge the room whenever you walk in. Whenever I go to counsel someone on medications as they're getting ready to leave, I make sure that I look up the medication, what it's for, the route, the frequency, how long they're supposed to be on this medication. I make sure that I'm ready with how to store that medication, what adverse reactions they should look out for. And so whenever I go in there, if I see that it is a suspension or a solution, I'll go in with a syringe and I'll judge the room whenever I walk in. And so if the patient is tiny, if they're a little kid, or whenever I'm talking to them about the medication, they don't really show a lot of interest, I'll try to engage them, but make sure that I'm talking to both the parent and the child so that I can make sure that someone will remember before they leave the hospital what I'm telling them. And so I'll go in with a syringe, I'll talk through my spiel of what the medication is for and how to take it, and then I'll hand off the syringe to either the parent or the child, or both, depending on the age of the patient, if they seem engaged and like they're understanding and comprehending what I'm saying, and just ask them to draw back the syringe to show me the dose that we had talked about that they'll be taking at home. If it is a little kid, I will tell them about the taste of the medication. And so as a pediatric pharmacist, I find it really helpful to know what tastes really bad so that you can let the patient know, like, mix this with applesauce or something. And so I'll always try and involve the kid, even if they're younger. I'll tell them about the yummy medicine or that they might get chocolate syrup whenever they take the medicine. But I do find it best to talk to the room and make sure that you engage all members of the family, just to make sure that someone is going to remember how to take the medication. And also realizing that they're going to get the same information whenever they go pick up the medication at the pharmacy. And so you are not the last person to talk to them, but hopefully you're going to be the first person to say those words to them so that it can be reiterated later and they already have an idea of how to take it.
Oh, absolutely. I would, if someone told me medicine tasted bad, I probably would not take it if I was a little kid. So I think it's very important. They say it's yummy and then it'll be okay. So I think it's important. I don't know. I know when I fill medications and it smells bad, I think of all the little kids that have to take it and swallow it. So I think.
Okay, Amber, I know we've talked a lot today, and you've obviously you're super educated and you've had a challenge getting to the position where you are now. We've talked about challenges with your job and what it's entitled to get to where you're at. So whenever you're feeling, a little unmotivated or burnt out, is there any stories you think back to that really inspire you to continue to push and stay in this career?
Absolutely. So the one patient interaction that really drove home to me that I was meant to be a pediatric pharmacist was back in my APPE. I was doing a rotation at St. Louis Children's, and it was on the HEMONC floor. And every day we rounded on these patients, and there was one that particularly just really wasn't engaging in rounds and just always looked so sad. She had acute myeloid leukemia, and so she was there for over a month in the hospital, and she just always looked so down. I was talking to my preceptor about this patient after rounds one day, and she said, yeah, she has long stretches of time in the hospital, and she gets down pretty easily because she can't really leave her room that much. And she doesn't necessarily understand why she's stuck here because she's younger. And so she said sometimes if there's free time after rounds and if we don't have a lot to follow up on, as a pharmacist, she'll like walk around and go see the patients and like hang out with them. And so one afternoon she scheduled for my the student that was with me, her and we went and hung out with that one patient in the afternoon. And so we let her decide what she wanted to do. And the nurses brought a karaoke machine. And we spent well over an hour just singing songs in the karaoke machine. And it definitely just solidified the fact that pediatric pharmacy was meant for me. And just seeing her light up and be engaging, and it really followed on like throughout the week. She actually smiled to us in rounds and just seemed much happier, and knowing that we were there for more than just medications, we're there to really help her all around and make sure that she had socialization. And I think that it really made a difference to the family as well, because they saw how much we could help outside of just like telling her what to expect from the medication. Really just solidified to me that I was where I was meant to be.
Such a tough story. I mean, really, at the end of the day, that's why we all are pursuing what we are, make a difference, even if it isn't just one patient's life at a time.
Absolutely.
Those stories really stick out. Alrighty, Amber. Well, we really, really appreciate your time, answering all our questions and spending time here, getting to know you and pick your brain.
Yeah, thanks for having me.
All right, guys. So that pretty much sums up our podcast. So we've heard from Dr. Lauren, a pediatric pharmacist.
Yeah, and it's also super important, I think, to talk about how kids really are super different than adults. In this world, that's why you get so much training, because it's not the same treating a little kid versus little kids too. They range from newborns all the way up to their 18 years old. So it's such a wide range of different subspecialties, even within pediatrics, that you could go into if you have any interest. So really consider it and see if anything appeals to you more.
No, 100%. The 7 years within our 7 years of schooling, like it's kind of backpedaling off the Deb. We get trained in a lot of things. We learn lots of things, but PEDS isn't really one of the major focuses we go into. So the after school and like residency training that we do is super important. And Amber did that, and it's important to keep your interests open.
If you ever have any questions or want to know more about pediatric pharmacy, don't be shy to reach out to us or to Dr. Lawrence. We will leave her contact information as well as our contact information in the show notes. And I hope you have enjoyed this podcast.
Yeah, guys, thank you so much for tuning in.
Thank you, guys.
Thank you. Bye.
Thank you, students, for hosting the podcast today, and thanks to our listeners for joining us. Please be sure to share this podcast and the other Dose of Knowledge podcasts with your friends on their social media websites. All the Pharmacy Frontier podcasts are available on Apple, Spotify, YouTube, and Podbean.